parent whose first language is not English? Please raise your hand. How many of you have helped or struggled yourself to understand instructions like these? So have we. As a certified interpreter and surgeon at Yale, I see how difficult it is for patients with limited English proficiency to understand medication instructions. LEP patients are twice as likely to experience medication errors. 62% of pharmacists are burnt out. The consequences, devastating. A diabetic patient double-dosed on insulin was found unresponsive. Another hemorrhaged from blood thinner medications. A child died because instructions were not properly translated. Pharmacies settle for millions, but no settlement can undo the death of a child. CDC shows that 9 out of 10 struggle with medication instructions every day. Our current tools fail. Phone interpreters are not available due to time zone differences. Google Translate is not HIPAA compliant. So we created INTERP, a patent-pending AI platform designed to verify understanding. INTERP's workflow. Pharmacist directs the patient to the kiosk for instructions in the patient's preferred language. Using visual, auditory, and pictogram-guided education, then quizzes the patient and generates an understanding score. With INTERP, trustworthy understanding is verified and every patient heard.
So this is how the interface of the INTERP looks like. So it asks for the details of the gender and the preferred language. No other personal information is required, and then the algorithms what we have incorporated, the OpenFDA RX norms API has been incorporated. So when the patient scans the token, it auto-populates the prescribed drug, and then it takes the SIG code and translate it into the choice of their preference. And so basically what the patient get in return is 3 important things. 1, playable audio in the language of their choice, translated text, and the visual pictogram. So we also provide the safety, the side effects, what to avoid, and when to escalate. There is an optional questionnaire. If they are able to finish the questionnaire, they get an understanding score. And we kind of prompt them to take that with a GoodRx coupon. And also finally, they can send all the translated text, pictogram, everything as a SMS. So the SMS will come in a secured link, and it provides the pictogram, the replayable audio link. The most important thing, this is no need for login, no data stored, so no very less complexity with the IPA compliance.
Yes, so our $11 million serviceable addressable market and the $300,000 a year 3 target revenue are anchored to states like New York and Connecticut that have large LEP patient populations where the need and the pharmacy density are greatest. And so beyond year 3, our revenue is projected to expand as we move into chain pharmacies, having perfected our open FDA medication instruction integration. Our go-to-market is we start with a pilot that's grant-funded in FQHC pharmacies, focusing on Spanish-speaking diabetic patients. And our pricing model is designed such that we serve each pharmacy type most sustainably. For example, our independent pharmacies will be serviced at just $99 a month. Competitive landscape is that INTERP is the only current solution that's built for the pharmacy counter that closes the understanding loop via SMS delivery and voice playback. No existing competitor can combine HIPAA compliance with pictogram-based guidance and understanding verification with minimal pharmacist intervention and app installation. So currently we are conducting customer discovery interviews while also applying for non-dilutive grant funding, also perfecting our open FDA integration. By fall, we will have a HIPAA compliant platform working in more than 10 pharmacies across Connecticut. And then in a year, we will focus on publishing our KPI and feedback-based study that captures all the work we've done. And this peer-reviewed evidence will transform INTERP into a venture-ready, commercially scalable product. Thank you so much.
Thank you so much. We'll move into judges' questions.
Hi. You said that you're going to be in 20 pharmacies by August?
10.
10. And are they already, have you secured them already? Or how are you getting?
We are in the process.
Oh, okay. And so what's the attraction like? I'm thinking what's stopping these pharmacies from building something in-house, at least have the basic translation tool, which is, I think, very open source nowadays. So can you tell me a little bit about how you think of
You
that?
are asking why they haven't built so
Yeah.
far? Well, it is not there, so...
Well, what's stopping them from building it in the future now that they're seeing something like yours that's, very enticing?
So currently in the United States, pharmacies do not legally have to have an interpreter, except for in California, Texas, and New York. So that's why it's not profitable for them to even have a telephone interpreter available. But then we wanted to target these states that had the largest amount of limited English-speaking patients, as well as illegal immigrants as well, need to get access to medications. And that is something that is a big need as well.
Yeah, I agree. It's a big need, and I'm trying to think. What are the incentives for pharmacies to be, buying your service? I mean, of course, out of the goodness of their heart, but there's no other incentive out there that.
So the 62% of the pharmacies report burnout. So they are not giving that information, even if they speak the language, or they don't have the time to call the interpreter and convey the information to the respective patient.
Also, legal liability has been a large burden, especially for pharmacists and hospitals. Usually it's a shared lawsuit. So I don't think that would be enough.
Usually 40% of the pharmacists are sued and 60% of providers are sued. That's the statistics, yes.
Thank you. That's good to know.
I liked it. I liked the app. I clicked it, downloaded it. Very nice. How many languages do you have?
Right now we have only 4. We built the prototype less than 2 weeks ago, but we are on the way. Yes.
Okay. And I was unsure of the stickiness for the consumer. Is there a consumer element, i.e., do I get to download the app as the consumer and walk away from the pharmacy, or is it just within the pharmacy?
Right now we focus within the pharmacy. We want to focus the independent pharmacy and the federally qualified health pharmacy, the low-income illegal immigrant. We want to start there. Our vision was to not for profit, but then we said, okay, let's stick with B Corp. Yeah.
Yeah, and also because you get your information after you provide SMS to you get all that information so you can
Okay, I think that's what's required in
There
the
is a
stickiness.
printout of the pictogram. We have a plan, like when the patient enter the kiosk, they leave with a printout of the pictogram, the translated message, and the visuals. Yeah.
Thank you.
I know we're out of time. I have one more question. In terms of current standard of care, how do you identify, I think in many cases it's obvious, but is there a current workflow that identifies patients who English isn't their first language?
So currently what happens is the pharmacist calls the telephone interpreter because that's the cheapest interpretation that's available, and legally that has to be in California, Texas, and New York. That's part of the legal system, so they have to do that's the cheapest method. So then they would call, it would take many, like 20, sometimes up to 10, 20 minutes because it's really hard to